Good afternoon, Nico Hidefield. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your role play.
Hello, my name is Lawrence, and I'm one of the nurses here. May I know your name, please?
Hello. My name is Mihiraa.
First, I just want to confirm the test you were scheduled for.
I'm scheduled for a gastroscopy next week.
Thank you for your confirmation, Mihiraa. Have you had this test before?
No, I've never had anything like this done before, so it's all new to me. And I'm just a bit nervous, to be honest. There's a lot I don't know about what's going to happen.
That's completely understandable, and it's exactly why we're having this chat today. I'm here to go through everything step by step so you feel fully prepared. Let me start by telling you what the procedure actually does. A gastroscopy allows the doctor to look directly at your esophagus, your stomach, and the first part of your small intestine. This helps them investigate symptoms like the pain you mentioned. They use a thin, flexible tube with a camera. If they see an area they want to check more closely, they can pass a tiny instrument through the tube to take those small tissue samples, which are called biopsies. They can also treat certain issues, like stopping a small bleed, during the examination.
I see. So they can really see what's going on inside. That makes sense. What do I need to do to get ready for it?
That is a wonderful question, Mihiraa. It's completely understandable to want to know what to expect and how you can prepare yourself. Getting ready for this procedure generally involves two main parts: what you do before you arrive and what happens once you are at the hospital. Before your appointment, the most important thing is managing what you consume. We ask you to have an empty stomach so the doctor gets the clearest view possible and to minimize any risk during the procedure. This means you must not have any solid food for a minimum of 6 hours before your scheduled time. You can have clear fluids like water, apple juice, or black coffee/tea without milk up to 2 hours before. We will also review your medications. If you take blood thinners or diabetes medications, we'll give you specific instructions on whether to stop them temporarily or adjust the dose, so please be sure to discuss your full list with us. Once you arrive at the hospital, we'll start with the final preparations. This includes the essential consent process, where we ensure you understand the procedure and any potential risks, and you'll sign a form. You will be asked to change into a hospital gown. We'll then discuss the sedation plan with you. Most people receive light sedation to make them sleepy and comfortable, which is given through a small 4-line in your arm. Finally, just before the scope is passed, the back of your throat will be sprayed with a local anesthetic, throat spray. This numbs the area, helping to reduce the gag reflex and making the insertion much more comfortable for you. We want this to be as smooth an experience as possible.
I think I'd prefer the sedative if it helps me relax. What happens after it's all done?
That's a very common choice, Mihiraa. The sedation is highly effective for making the entire experience relaxing and comfortable for you. After the procedure is complete, the process shifts entirely to recovery and post-procedure care, ensuring you are completely safe and comfortable before you go home. Immediately after the scope is removed, you will be moved to a recovery area. Because you've received sedation, our nurses will closely monitor your vital signs, your blood pressure, heart rate, and oxygen levels, until the main effects of the medication begin to wear off and you are fully awake. During this time, you might notice a few temporary after effects. It's common to feel a little bit bloated or gassy, which is just from the air we introduced during the examination, but this passes quickly. You may also have some temporary throat discomfort, like a mild sore throat from where the scope passed, but this should also be short-lived. The most significant feeling will be drowsiness. The sedation will make you feel sleepy and slightly uncoordinated for several hours. Mihiraa, once the team is satisfied that you have recovered adequately, we'll start the pre-discharge process. It is a mandatory safety measure that you must be accompanied by a responsible adult to take you home, as the effects of the sedation make it unsafe for you to drive, operate machinery, or make important decisions for the rest of the day. For your post-discharge care, we recommend sticking to light, easily digestible food for your first meal and avoiding strenuous activity or alcohol until the next day. The doctor will also discuss the preliminary findings with you and your escort before you leave. Given the requirement for an escort, do you have someone who is scheduled to pick you up and stay with you for the rest of the day?
Yes, my sister has already said she'll take the day off to drive me and stay with me. That's reassuring. When will I find out what they saw?
That is wonderful news, Mihiraa. Having your sister there for support means you can focus entirely on your comfort and recovery. You've already taken care of a very important piece of the plan. Regarding your results, you won't have to wait long to get an initial understanding of what the doctor found. The doctor performing the procedure will provide you with immediate verbal feedback right after you have woken up from the sedation while you're still in the recovery area. They will explain what they observed on the lining of your esophagus, stomach, and duodenum. This is often accompanied by a preliminary printed report and images from the camera. This initial discussion will give you a good idea of what they saw and whether everything looked normal or if any immediate concerns were identified. However, if the doctor took any small tissue samples, known as biopsies, to look at them under a microscope, those results take a bit longer. These samples are sent to the pathology laboratory for a detailed analysis, which is crucial for confirming a diagnosis, such as whether a particular change is inflammatory or something more significant. Typically, the pathology results take around 1 to 2 weeks to become available. We will then arrange your follow-up plan. This might involve a specific appointment with your specialist consultant to discuss the final findings and next steps, or the results may be sent directly to your GP, who will then contact you to discuss the final diagnosis and treatment strategy. Rest assured, you will be contacted as soon as all the information is complete, so we can discuss the best way forward for your health.
2 to 3 weeks for the biopsy results. Okay. I think I understand it all a bit better now. Thank you, Lawrence. I feel much less worried.
You're very welcome, Mihiraa. My pleasure. Please don't hesitate to call the department if you think of any more questions before next week.